Hi, my name's Cameron Keeley. I'm an osteopath, founder of Recharge Osteopathic Clinic and Migraine Solutions, and we're running a talk on the 5th of April on how to prevent headaches and migraines without using medication. So what we're talking about in this particular talk is symptoms like reoccurring headaches, migraines which are happening reasonably frequently. So not I get a migraine once a year. We're talking more I'm getting a migraine at least once every few weeks, and symptoms which also you may not recognise as being in this category: sinus pain, which keeps coming back. People with a foggy head. I've just always got a foggy head. It's really hard to think. These are often headache or migraine type signs that are poorly recognised as actually being in that category. So all of these tips will be effective for those situations. So if we look at our pyramid there, so it's kind of like our food pyramid, and it's basically saying the order of importance that I'd place on treating areas to prevent reoccurring headaches or migraines. So down the bottom we've got the musculoskeletal system, and the reason that I think that's the most important is because if you can adequately fix up that area, usually you don't have to worry too much about all of those ones above it, and that'll usually give you a pretty good resolution of most headache and migraine situations. But so the areas you're looking at is like jaw, neck, lower back, and so we're going to be talking about a whole bunch of stuff that you can look at in that area. And the next one is diet. There's a lot of dietary triggers feed into migraines. Really important to know, if you are getting a lot of them, what your triggers are. And the thing is, most people don't actually realise what their triggers are, and everyone's triggers are slightly different. So we're going to be looking at that a bit. Lifestyle, stress obviously feeds into headaches and migraines. Exercises, some exercises will tend to cause migraines, some will be better for you. And so we're going to be looking at a little bit about that as well. And the top one is medication. There's certain medications which are more appropriate for migraines, in fact will only work for migraines and not work for headaches. And there's other medications which are more headache based, your typical over-the-counter Nurophens and Panadols and Panadines, which everyone kind of knows about. So that's the way that I would suggest people kind of combat reoccurring headaches. The way that it's generally done in the community, if we were going to generalise, is the pyramid would look more like this. And that's what we're trying to get away from, is this mentality of just, I've got a headache, let's pop a pill, get rid of it, it goes away for a bit, and then sooner or later one comes back again. And if you think of it as a headache as being a pain in your body, and your body's trying to tell you that something's wrong, and there's an imbalance in one of those areas, if we can fix that imbalance up, the headaches will stop, the body will stop telling you that there's something wrong, and we don't need to worry about popping these pills and taking medications. So that's what we're going to be talking about. Come along down Wednesday the 5th of April at 6:30. Hopefully see you then.